And this can be an action not just on the tissues, okay, so not just the soft tissue, so all the muscle, all the thoracolumbar fascia, but also an action like a springing action to feel also the resistance on the spine, okay? So it can be like a posterior anterior action, okay, or transverse action, rotation, okay, and finding out the resistance, okay, at which level is and in which motion is, okay, it can be useful. So it's a test, but also a way to address technique. And it's impossible to separate the action on the tissue, the soft tissue, and on the joint, because every input you give at the tissue, the soft tissue arrives also at the joint as more as you apply pressure. Okay, and also not just joint, but also the disc, the vertebral disc. So it's impossible to say, okay, I'm acting only on the joint, I'm acting only on the disc, I'm acting only on the soft tissue. It's always a matter of working on the quadrant of the tissue that are surrounding this big area. A general action with the palm of your hands. Okay. Apply this transverse and diagonal pressure. Okay.